let's start with like the issue, right? Representation matters. What just for the person who's like just coming into this conversation, why does representation matter in medicine? I'll start, and I want you both to answer this, but I'll start with Dr. Essien.
Why does representation matter? We like see all these hashtags and we talk about it a lot. But I think I'm a scientist, as you mentioned, and so the data is really where the story is here, where we know that, for example, counties that have more Black physicians have lower mortality rates in Black community and Black populations in those counties. We know that patients who have a doctor that looks like them are more likely to actually want to receive both preventive and more acute care management. So vaccinations for the flu, more willing to undergo heart surgery. And we saw this play out during the COVID pandemic, where we had really large populations who literally couldn't even communicate with their provider because they weren't speaking the same language. And we saw this, I think, particularly hit Latinx populations in states like we're all in Massachusetts and Boston and the East Coast, and here in California. And so this matters. This matters to be able to actually literally save lives. And I'm hopeful that some of what we'll be talking about today will be able to get to some solutions as well.
Yeah, and I know that Dr. Parr, you're really heavily invested in that representation pipeline. Tell us a little bit about that.
To agree with everything he's saying and more, like representation is so important to me. I'm not a physician, but I work with physicians. I believe heavily in interdisciplinary approaches to be able to solve complex health problems, right? So as a public health professor, I go above and beyond to make sure my lab is diverse, to make sure that people that young girls, young Black girls, young Black boys can see themselves in places like Yale and other universities doing the type of work that I'm doing, if not more. And it's important because when we think about researchers who are doing work with Black people that don't look like us, you don't understand our lived experiences. As a Black woman, I can connect with another Black woman or another Black girl more than anyone else because I have that lived experience as being a Black girl at one point, and also I'm invested in seeing their health outcomes increase and seeing their health outcomes remain positive, mainly because of that cultural competency that just naturally, I have. So I think with representation too, we can't become what we don't see. Right. So, growing up, I've never met, I think until I was probably an adult. And when I say adult, I mean like past grad school, that I even came across the first Black
Right.
doctor, and I had to kind of like seek that out. I never came across a Black professor until I was getting my PhD, so, and I just got my PhD not that long ago. So so we have so far to go. But it's important that for me to be able to see those type of people that look like me, because I'm able to aspire to be in those spaces because I have an opening. Like I have people that look like me, that can speak my language, that understand our experiences.
I just wanted to also just
Mm-hmm.
reflect on what you both said, which is about the idea of representation in the clinical and research space, right? And so that obviously, I think, has two immediate, really obvious impacts that I think most people understand straight away. If mentorship and role models, right? So if you want the pipeline to work, you have to have people like you all, who people can say, I want to be that person. That's number one. I think that's pretty obvious to people. And two, I think, as you said, there's a piece of like, how come I'm the patient, but nobody looks like me who's actually treating me, and that can feel that can put a distance between medicine and patient, or and research and patient. So those things are obvious. I think that what people often forget is like people like me, like what can I do?
Right.
And the answer is to recognize how enriched my practice has been by having been around, a community of not just the old boys network that it was 50 years ago, right? Like I'm a better doctor to my patients of color than I ever would have been if I was trying to wing it out of a book. That just doesn't work. And so I just have gratitude that value was in place early enough that like I know docs and researchers like you guys, because it actually helps me, bridge that gap with my patients. So it's really important, I think, for people like me, the white guy,
Absolutely.
to recognize what a immense amount of progress we've been the beneficiaries of by, living now as opposed to then, and we don't want to go back. So in that realm, not great news. Supreme Court said affirmative action, as it stood for admissions, can't be relied upon. Are we already feeling this?
It's a great, again, important question. I think your phrasing of "we don't want to go back" is an interesting one, because I'm wondering who the "we" is there. Because I think a lot of people do want to go back, but I think the "we" in this room, IG live room, don't, right? And so I feel like I'm talking to a number of individuals who are applying to medical school right now or applying to residency. And it was a really interesting conversation I had with this young Black woman early in her career, applying to medical school, who was not considering applying to medical school in her state because she was worried about what the repercussions of this affirmative action ruling would be, and whether she would actually be able to get in, and if it was worth the hundreds of dollars application fee, and if she did get in, if there would be conversations around how she could be supported as a Black woman. And so one anecdotal case, but you expound that across the country, and you wonder how this is really going to impact not even just the people who decide to pursue this field, but the future of our workforce. And so it's something that we've been talking about since the ruling, before the ruling came out. And again, I'm concerned about how we're going to be able to continue to diversify the workforce with policies like that in place.
Yeah, I just to add to that, and one point I would do want to make, Jeremy, before I even answer that question, is that I do think it's important for men like you to be in these spaces to support your patients in that way. And I'm grateful for, and I think it's beautiful that you're taking the time to be humble and learn from other physicians of color, from researchers of color. It's because it goes a long way. To go back to the affirmative action question, I think it may be too early to even see on my end, right? So in public health, I can speak for my department within the Yale School of Public Health, we are really dedicated to making sure that diverse voices and people are in the room or in the classroom doing this work. We know that we can't go far if we don't prioritize diversity in public health. And, we can argue in medicine too. So we are still going through the admissions and accepting, continuing to go through the admissions for PhDs candidates, for MPH candidates, et cetera. But I have talked to students who reached out to me and said, like, I want to apply this program. Like, am I going to feel safe, in these spaces? And I try to assure them, like, at least in my department, you will. In my department, you will. You know what I mean? So I can speak for my department and stuff, but I do think I don't think people realize how it is a problem that high school students are seeing, like middle school students are seeing, and it is really getting into their minds about whether they can fit into these spaces, but they absolutely can. And I think if we just continue prioritizing the value of having diverse populations, I'm hoping that, we can undo that. But I don't know, I've had so much, I've lost so much hope. And I'll be honest with you, but
Yeah.
I do, I think that, this has to be an effort that we have to lead and really support.
Atiba, you said something like some people do want to go back, and it's interesting because I'm sure there are people who are like, just their worldview doesn't really make any sense to me, and I know it doesn't make sense to you. But I actually think a lot of people are in a different category when they look at these things. They think that they believe that it's a good thing to have a diverse workforce, or maybe they do believe that, but they just think that the way that we've achieved that or have made progress is counterproductive, or that there are problems with affirmative action as the solution to it.
Yeah.
But I think that it's like my viewpoint, and I want to hear both of what you think is what you both think is that like it matters so much the outcome, like that we have clinician leaders and research leaders like you, that you can't just like take something away and not replace it with something that's going to bring the outcome that we need,
Right.
which is for this research to be done or these clinicians to be present. So do you think that like there are people who out there who, am I right, who they think they want the diversity, but they think that affirmative action like isn't the way to get there?
Yeah, I think that probably is the case. And I think a lot of that conversation comes from a lack of a historical perspective, right? Like the reasons why affirmative action existed was because of the centuries long unequal access to education in our country that still exists in many places. I grew up in New York City, greatest city in the world, obviously no bias, but we had a segregated public health or public school system in the early 90s, and we probably still till today have. And that's in, again, this super diverse city, much less around the rest of the country. And so to come up with policies to help to address the inequities that existed for centuries, for about 40 years, I think we had affirmative action. And even prior to 2022, 23 rather, we were trying to reverse it. It just doesn't really make sense. And our data has suggested that states that actually got rid of affirmative action actually literally resulted in lower rates of underrepresented in medicine students to go into medical school. And so we had a policy that was established to address the historical inequities. When we get rid of the policy, it actually doesn't work in certain states. And we decided to get rid of it at a broader level. So I appreciate definitely the nuance that comes from when you use those two words together, and how political it can be and triggering it can be for a lot of people. But it was a policy that worked in some places and I think had a lot of opportunity to do more. And it's the same conversation that we're having right now around DEI. We're seeing offices of diversity, equity, and inclusion shut down around the country. We're seeing leaders in those spaces being kind of quieted in the work that and effort that they're doing. And it's very possible that in 30, 40 years, we'll be having conversations around the Supreme Court making decisions about DEI efforts, and us being really curious about where this came from and how did this start. So I think we really do have to be aware and take caution in some of these conversations that we're having.